All right, hello everyone, and welcome to the Babies in Common show. I'm Jeanette.
And I'm Melissa.
I'm Kelly.
Awesome. So today is Melissa.
June 25th, 2020, and we will be talking about extended nursing and tandem nursing.
Yes, and our special guest is Kelly Shultz, and she's got 2 children and will share her breastfeeding story with us today. Very personal. There's a lot from her story that I know that many of you who are listening or watching this are going to learn from, be interested in. She's got some fun aspects to her story as well as some serious ones. And so Kelly lives in central Massachusetts, so she's a local mom who's been coming to the Babies in Common groups for many years now. So thanks for saying yes, Kelly. It's kind of a personal thing you're about to talk about.
Thanks for having me. It's one of my favorite things to talk about. So I'm excited to talk to you guys about it.
Awesome. So before we get started, let's just talk about a few definitions. Tandem nursing is simply nursing 2 or more children of different ages at the same time. And usually this occurs when you have an older baby, toddler, or child that you are nursing, and then you add a new baby into the picture. I used to think that tandem nursing was when you're nursing twins, but that's not what we're talking about today. We're talking about nursing 2 children that are of different ages. Okay, and extended breastfeeding is kind of a controversial term because only really in Western countries do people consider breastfeeding after the age of 1 to be extended. Most other countries around the world consider nursing past the age of 1 year to be a normal part of the breastfeeding relationship. In fact, the World Health Organization recommends exclusive breastfeeding until 6 months of age, and then continued breastfeeding up to 2 years of age or beyond with the addition of complementary foods. And even the American Academy of Pediatrics states that breastfeeding should be continued for at least the first year of life and beyond for as long as mutually desired by mother and child, or just feeding parent and child. And so really the term extended breastfeeding is controversial because many people who do nurse their children beyond a year, don't like the term extended because it makes it sound like it's odd or unusual or something more than what is normal. So full-term breastfeeding is something of a term that is often used to describe the same idea, nursing a child after the age of 1. And I'm not going to get into the history of it, but it does have to do with formula and marketing and all of that. So today we're going to be talking about tandem nursing, nursing 2 children of different ages, and full-term breastfeeding, or other known as extended breastfeeding. So.
Awesome. So Kelly, I met you after you had your first baby and you came to group, but when you were pregnant with him, what was your plan for breastfeeding?
My plan was to breastfeed. I took a breastfeeding class, my husband and I did, while I was pregnant, that in hindsight was not as helpful as it could have been, but better than nothing. And so when I was in college, I used to procrastinate from doing my work by researching birth and breastfeeding stuff and so I already knew that
junkie through and through, Kelly.
Right. So I already knew that the WHO recommendation was to 2 years. So that was what I had in mind as what I would shoot for. So yeah, that's how I sort of thought that I would prep before he was born.
And I love that your husband went to the class. I always say, because I teach prenatal breastfeeding classes as well, and I always say it's actually more for your partner than it is, your partner, your sister, your mother, whoever's going to be helping you in those first several days and weeks, that is more important for them, even because they're actually going to remember what we said in class, and they can see more than you can, because all we can do is look down at our babies. You can't see all the aspects and be like, hey, you're not holding your baby the way they said, and try this, try that. Yeah. So that's helpful.
That's pretty cool, Kelly, that you had done some research, before even considering getting pregnant, because a lot of people, including myself, and I grew up in a very breastfeeding friendly environment. I'm the oldest of 7 kids. My mom breastfed my brothers and sisters. I remember her pumping before going to work as a waitress with one of those hand pumps. We had to pull it out like a trombone, and I grew up around boobs and bellies and breastfeeding, but even I had that 1 year thing in my head. I was thinking, if I can make it to a year, that's what I'll do. And then the baby will just magically wean or not need it anymore. I don't know what I was thinking, but then I started breastfeeding and I was like, crap, if I can make it to 6 weeks, I'll be lucky. And then I made it to 6 weeks. I'm like, oh yeah, no, I got this now, because it's hard in the beginning. So that's really cool that you had, done some research prior, because a lot of people don't know that it's normal.
Yeah. So what happened with your first one?
It was a very rough start,
Oh, wow.
put it mildly. So I started going to group just because I wanted a place to go where I wouldn't feel weird, like breastfeeding. Um,
Isn't that sad in our society?
It
Something
is so
so
true.
natural, normal, good for the baby, good for the parent, and we feel weird. And it's the law in all states now that you can breastfeed
right.
anywhere that you're otherwise welcome. And yet, we still need to seek out. There's something about
Yeah.
people who are trying to breastfeed or even human milk feed that is more bonding than just the typical like parents group, you know?
Right. Yeah. And
Absolutely.
so it was like, my social outlet. It gave some sort of structure to my very unstructured time. And so I didn't realize for quite a while that we had issues because he was gaining weight fine. Um, because apparently I had a very forceful letdown, so he would just sit there and gobble it up. And so the pediatrician's like, he's fine, but he would spit up a lot, and then he would like dribble milk all the time. I was like, have to like we used cloth diaper, so I'd take like a clean one and put it there so that my outfit wouldn't get all wet every time I fed him. And like, this is my first kid, and they didn't tell me enough at my breastfeeding class, and I didn't know that wasn't normal, and it was painful. And the nurse in the hospital was like, oh yeah, it's painful in the beginning. And of course, like nobody tells you, first of all, that's like, doesn't need to be painful. And second of all, everybody's level of pain is so subjective that I'm like, okay, well, how painful is it supposed to be? Like, what's normal? So anyway, I had all these issues and I didn't realize there were issues until he was about 7 or 8 weeks old. And he started like clamping on my boob like it was a sandwich so hard. And I
Ow.
was like, I don't think I can feed this child one more time or I might die. And so finally I called Jeanette. I was like, help, help. So she came over and he had a lip tie and tongue tie.
Which I did not officially
Mm.
diagnose. I just told you I was seeing signs and symptom
Right. So
consistent.
then we had to go to the dentist. So then we had to go to the dentist. And lo and behold, she was, the signs and symptoms were right. So he had them released. It did not go well. They reattached. We went back to that dentist. Long story short, didn't really like him. He came back. We had to go to another dentist. Had to be released again. So all in all, he had his lip released twice and his tongue released 3 times. And then Jeanette and the dentist had reasons that they thought that he was an unusual case and was worse than most kids. But anyway, it was like a 5-month awful, terrible saga.
Oh my gosh.
And but we pushed through, and his latch got acceptable. It was never well, for a long time, it wasn't fantastic after that. But it was good enough that I wasn't in pain every time that I was nursing him. And it, would just live with it. It was fine. But yeah, so
So
eventually it was good.
everybody, seriously, anybody who can grow a human being is a superhero in my book. No matter how they get out of your body, it's superhero status. No matter how you feed your baby, you're an incredible mother. Breastfeeding is another, challenge that many people have to overcome. But let me just say, Kelly, you definitely deserve a medal. Breastfeeding is hard enough, right? With being, on demand for the baby's feedings and using your own body to do it. And it's challenging and exhausting in many ways, rewarding in many ways, wonderful and convenient in many ways. But to have to go through that much pain and discomfort and stick through it, wow, you are a strong person. That's amazing.
That's for sure.
Well, I've said this, I think, to you before, Kelly, and to others, but you're the kind of person that makes me keep wanting to do what I do.
I agree.
Because it's still challenging, and I feel sad too because I'm always learning new things. And I think back to when I was working with you, that there's so many new things that have been taught since then, and there's new cooler things that I think back, oh, that would have really helped Kelly and a bunch of other people too, but nobody was talking about them back then.
If you don't know, you don't know.
Yeah,
right. And once you know better, you do better, right? Was my
Right.
Angelou.
Yeah, and even if I remember correctly, don't say any names, but wasn't the first person you went to really far away?
Yes, and I believe you told me that I was the last straw and you would no longer be recommended.
There you go. Yeah. So not everybody should need to go to 2 dentists to get this done,
Right.
but I see so many cases online in different groups I'm in where there's a lot of parents who have tongue-tied babies in the group, and that's the primary source or reason of the group. And instead of seeing a lactation consultant, IBCLC, who has extra training in tongue tie, they're just like, oh, I'll skip that part and go straight to the dentist based on what one or two or three people said in the group. Oh, go to this person. And I'm watching it as well as some of my colleagues. And then we're messaging each other sideways and going, why do they keep recommending that person? You know, like.
Well, and the thing that I found so helpful about seeing you is that we also recommended that we take them to the chiropractor, and we did that.
Right.
And it was at the time, so we have switched to a family practice doctor. So the kids and I all go to the doctor. So second time around, it was nice because there's somebody who's looking at us as a pair, but you were the only one who's looking at us as a pair, because I could go and talk to the OBGYN or my primary care, or I could talk to the pediatrician, but none of them were looking at us as a pair. And I felt like you were the only one who did. And so it was super frustrating, which is one of the reasons that we switched doctors. Because I was like, I can't have the lactation consultant be the only one who's like looking at us as a pair. It's ridiculous.
Well, can that be like in a text? I mean, honestly, everybody in this profession needs to look at the parent and child as a pair. They are a dyad. They are a couplet, however you want to call it. You have to look at them together. There's so many things: sleep, feeding, just so many things that you have to look together as a pair, because you're two but you're one, right? I don't even mean to be like, emotional about it. I just like physiologically there's so much between, you can't just treat thrush in a baby, for example, if you don't also treat it in the mom, right? Like it's just going to be a problem again and again. So.
However, most of the time, just as an incident, because you brought that up, now most of the time babies don't have thrush in their mouth, and oftentimes if the mom does have thrush symptoms, oftentimes it's a bacterial infection and not
interesting
thrush.
See, there you go.
So
that's why we always have to keep learning.
Right. It used to be thought that thrush was just so pervasive, and really what they started to learn was that most of it was bacterial and not thrush. But, and to Kelly, your point, you also are dealing with several providers who are well-meaning and have a lot of training and a lot of things, but breastfeeding isn't one of the things that they were trained in either. Right. So each one might know a little bit here or there, and sometimes they know exactly what you needed them to know. But yeah, so what we do in lactation is look at both of you, and with our current insurance situation in the United States, either it's not like anything is billed under both the baby and the parent as well, in most cases. So that was a challenge. And then can you tell a little bit more about how it got better?
So I got pregnant when he was 13 months old, and then my milk dried up when he was about somewhere like 16 months-ish, somewhere around the end of the first trimester. And
it's fairly common for people who get pregnant. The milk kind of can dry up, and your body's going through like the process of trying to make colostrum again and things like that. So, continue.
So he made it very obvious he was not done nursing.
Oh.
He's like a boob monster. And so I was like, whatever, I don't care. I'll just keep dry nursing him. It's fine. And so we did. So I nursed him for comfort, and I wasn't concerned about like the nutrition part of it. He was over a year. He was eating fine. But
was it painful for you to dry nurse? Like some people have really sensitive nipples.
But it got more painful as time went on. So eventually I cut him down to only nursing at nap time. And then one side got really painful. And so I stopped letting him nurse on that side. So he was only nursing on one side. And then about a month before I was due with my second kid, it got so painful that if I hadn't been due in a month and known that his life was going to be thrown in a tizzy anyway, I would have made him wean. But I didn't want to do that to him because he was about to have a new sibling and life is going to be crazy. And I was like, okay, this is like the one thing that he has still, so I'm not going to take it away from him. So I called Jeanette again, which, fun fact, my insurance covered, even though he was 21 months old.
There you go.
And so she came over and we talked about, some ways to work on his latch and whatever. And the cool thing was, by this point, he was old enough to follow simple directions. And his latch got perfect.
Wow.
It was, my boobs are still sensitive, so it still kind of hurt until I had the baby. But after the baby, it was like the best his latch has ever been in his life. And so I was like, ooh, it's like magic. Like having a kid who can follow directions. Like, open your mouth wider. And he's like,
right.
okay.
I remember that was part of it, right? You just said it, so I'm not disclosing anything you didn't just say, just for the record. But like, it was that telling him directions about try this, do this differently, don't do it that way, that he was able to be like, oh, okay, I'm trying to make my mom happy.
Right.
And then it got better, which,
that's amazing.
Yeah.
I give you a lot of credit for nursing through pregnancy. Many people do, and it's mutually beneficial for mom and baby. I felt like bugs are crawling all over my body when my son would
Yeah.
nurse when I got
Wow.
pregnant.
I have friends who have said the same thing to me.
Yeah, yeah. If that is something, if somebody's listening and that you've experienced that, you are definitely not alone. There's some
Okay.
hormonal thing. I'm sure it
Mm.
has to do with the body being like, let's stop nursing the first baby because I got to save the milk for the new baby. So it's got to be some kind of biology behind that. But yeah, I literally would feel like there are bugs crawling all over my body. And so what I would do, it's so funny that you said like you would cut them down to one boob and then you would come down just now. I did the same thing. So my son was about to turn 3 when I got pregnant with my second. And so it was so painful. And I felt so like bugs and everything that I would go, okay, you get 10 seconds on each side. And I go, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I was like, okay, you got to do the other side. I go, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You know, and, like, and so I the way I got him to wean actually was he was turning 3. I was getting to the point where like my milk was drying up. It was getting even more painful. So I bribed him with eggnog and it worked like a dream. I said, when you turn 3, you know what? You don't drink mommy's milk anymore. You drink eggnog and it's the greatest thing ever. He was a Christmas baby, so there was eggnog around. And he was like, this is great. So then Christmas came, Santa brought eggnog and the rest is history. So if anybody out there is looking for a weaning technique, I highly recommend Pearson's Dairy and Milbury's eggnog.
That's
Oh,
yummy.
man.
Yeah, I know everybody has such different experiences with pregnancy. One thing I know that there are some care providers that will tell someone, "Oh, well, you're pregnant now. You should stop nursing because the baby that's nursing is going to take away nutrients from the fetus, and that is not true."
Not true at all, no.
Yeah,
And also, it's only something that you should consider stopping if you're at high risk for preterm labor. So the
yes.
other thing people say, a lot of physicians I've heard say, that you can't tandem nurse, you can't nurse while you're pregnant, excuse me, because nursing simulates the release of oxytocin, which is what squeezes the milk out of the nipple into the baby's mouth. And oxytocin is what gives us labor contractions, and therefore you cannot nurse when you're pregnant because it'll put you into preterm labor. Now, there are some people who have high-risk pregnancies in which they are at high risk for preterm labor and are told things like no nipple stimulation, pelvic rest, meaning no sexual intercourse, no orgasms, no nursing. Okay, so that would be something totally different. An otherwise healthy person with a healthy pregnancy, no risk factors for preterm labor. You also secrete oxytocin when you have an orgasm, and people aren't like popping out, micro preemies every time they have an orgasm. So like, that is also false. So if you've ever heard that, like,
Yeah.
Unless you are a high risk pregnancy,
Yeah.
nursing during pregnancy might be uncomfortable for you. Sometimes if your nipples are sensitive, but otherwise it's not going to harm your baby or cause preterm labor. So,
And your colostrum will still come in. It's really interesting too. There's some stories where people have switched to nursing their toddler, which usually it's toddler by that point, on one breast only, and then letting the other breast rest for a few months so that that breast definitely has some rest time, because there's some science between giving there some rest time in between to help bring in more milk. So if somebody had a lower supply, then that is an interesting idea to stop nursing entirely, to build up some time in between so that you can increase your likelihood of making more. But colostrum will still come in even if you're nursing the whole time. Or in your case, Kelly, you said you were dry nursing, which is what I did as well with my first. And she was talking and she would say, there's no more milk, but when the baby comes, there'll be more milk. And she was so excited about it. And it was so cute. And it was uncomfortable towards the late part of the pregnancy, but I would do similar to you, Melissa, where I would be like, okay, just 3 minutes, and I'm like, okay, we're almost done. It wasn't super painful, but it was a little uncomfortable. And I don't know that I would say bugs crawling, but I definitely didn't feel super comfortable. But it was so helpful to get her to sleep that it was this trade-off.
I know, it's totally like, that's what also a lot of people who are thinking about, should I wean my toddler? Or it's one of those, like, that's one of the benefits for many people of breastfeeding, is that it's like, I don't know, nature's greatest.
Solves every problem, pretty much.
Yeah, it kind of does. Like, they fall down and bump themselves breastfeeding. They can't sleep breastfeeding. They're teething breastfeeding. They have the stomach flu and they won't eat anything else, but they'll breastfeed, So it's like, oh, it's a nice tool in your toolbox.
Yeah.
The other thing I was going to say is, sometimes that's how children will self-wean. And sometimes people want to tandem nurse. They're planning on tandem nursing, but the milk turns back to colostrum and the child is like, this tastes not like your milk. What happened to your milk? And then they were like, I'm done with this. And then they wean. And maybe they'll go back to it when the baby comes and they see, oh, there's milk there. But
or the milk goes away because you're pregnant, which clearly happens in some pregnancies, but not all.
Yep.
And then the baby's like, why am I bothering nursing? There's no more milk there.
Right.
Every child is so different.
Totally different.
We were referring earlier, like it's a diet, it's the two of you together. And so as the adult, you get to decide whether somebody sucks on your boobs, but also as the child, they may want to stop nursing before you're ready for it emotionally too, which is so hard. I mean, it's not supposed to be biologically normal for a child under the age of 1 to stop wanting to nurse. So there are people that have said to me like, oh, well, my 4-month-old decided they didn't want to drink. And I was like,
I would call an IBCLC if that was the case.
There's something going on there. Or like your 11-month-old really likes food and not nursing. Like, okay, that's close to 12 months. And if you're planning on stopping at 12 months already, like, okay, there's some wiggle room there. But yeah, so sometimes the things that we're told are not really accurate. So yeah. So can you share how your second baby came into being? On the earth, I mean, not the other part, but not. We don't
want to know the very beginning. We just want to know the
end. The birth part.
So, okay. So I endured the longest 2 weeks of my life because my first kid was born 5 days before my due date, and my second kid was born 10 days after my due date.
Of course he was.
Every single morning I woke up and I'm like, why am I still in my own bed? Why am I still pregnant? What is this? I'm like, pregnancies are 39 weeks, 2 days. Don't you know that? Like, apparently not. So finally, I woke up in the middle of the night, had to go pee. My water broke. And I was like, oh, that's interesting. So, brief pause. For reference, my first pregnancy, I was in labor for like 18 hours and I pushed for 2 or more hours. So that's what I was expecting labor to be like. So the midwife that I was working with was like, okay, well, if you have contractions or your water breaks, give us a call. So I called them. It was like 1:30 in the morning and they're like, I'm like, okay, well, my water broke and you said to call you. So I'm calling you. And they're like, okay, well, do you want to come in? I was like, no, I don't even have any contractions yet. Why would I come in? And they're like, okay, well, call us when you're going to come in and we'll see you when you get here. I'm like, okay. So I called my mom. So I'm in Massachusetts and they're in New Jersey. So it's about a 4-hour drive. And so I called her. I was like, it's not an emergency. You don't need to come right now, but sometime in the next 24 hours or so, I'm going to the hospital. So like when you wake up in the morning, come to my house. She's like, okay. So I think she went back to bed. I tried to go back to bed because with my first labor, I was sleeping on and off for like the first 6 hours I was in labor. And so my husband has this skewed view of how long it took. I'm like, no. I was in labor a lot longer.
I didn't wake you up when it started, all right?
I was like when it started getting serious. So anyway, so I laid down and so she was born in June. So it was hot out. We had the window air conditioner in. My son was in our bed because our room was the only one with air conditioner. So my husband and I are like chatting over my sleeping son's head. And so he's like, okay, well, what do you need me to do? I'm like, oh, nothing, I'm fine, blah, blah, blah. So then my contractions started about maybe half an hour-ish after my water broke. And I don't know if I'm just like oblivious or what, or I just like can't count time. I don't know. But apparently my contractions were like way more serious than I gave them credit for.
Melissa, have you heard this story before?
No.
Oh, cool.
So I'm like getting up, going to the bathroom, not feeling so great. My husband's like, oh, do you want me to like go make you breakfast or something? I'm like, no, I'm fine. So finally I'm like, actually, I don't really feel great. Can you like come downstairs and make me some toast or something? He's like, yeah, sure, whatever. So with my first pregnancy, we were in the middle of making breakfast and I started bleeding. So I had to go into the hospital earlier than I would have otherwise. And so my husband's like, so this time around, can I finish breakfast before we go to the hospital? I was like, fine, whatever. So
there should be a whole blog about like what the partner says, like darndest things. Partners say the darndest things, like my hands hurt when like you're like pushing a baby.
You tell me to take the wedding ring off the first time, because it hurt when I was.
Oh, you poor thing. Yeah, right.
So he's like making himself scrambled eggs, and I'm in the kitchen being like, oh, it's another contraction. And so finally we're like, maybe we should think about going to the hospital.
And this is like 2:30 in the morning by this point?
Yeah, somewhere around there. So he calls our neighbor, who is like our backup person, to come and stay with my son. And he's like, okay, well, it's not an emergency. Famous last words.
Famous last words.
Can you like, make your way over to our house, whatever? And she's like, yeah, sure, no matter, whatever. So she has to get up, she gets dressed, she looks for her phone. She lives 2 doors down the street from us. So like it could not have been more than like 15 minutes. So my husband goes downstairs, goes to put on clothes, and I went to the bathroom. Stupid move. I was trained as an EMT. I know I shouldn't have gone to the bathroom. So anyway, I went to the bathroom, and then I'm like, finally like, this doesn't feel like I actually need to use the toilet. This kind of feels like a baby's head. So I'm like, shouldn't sit on the toilet anymore. So I like am in the doorway between the bathroom and the kitchen, and I'm like, this baby's head is coming right now. So I yell upstairs to my husband, who can't hear me because he's in our bedroom with the air conditioner on. And I'm like, so I call louder and in a more panicked voice. He's like, what? So he comes flying downstairs. I'm like, call 911 because the baby's coming. So he's on the phone with the dispatcher and catching her at the same time. And he's like, the baby's coming. I mean, I see the baby's head. I mean, we just had a baby. And about 2 minutes later, my neighbor shows up at the back door that leads directly into our kitchen as I'm standing there with my pants around my ankles, holding this new baby that's still attached to the umbilical cord. And we're all like, everybody's quiet because we just talked. And she walks in and she's like, the way she tells the story is, it was a little bit too quiet for a house where somebody's in labor. So she looked at us and she's like, and you were just standing there in this awkward position. And then she was like, did you just have the baby? Nope. And then a few minutes later, the paramedics show up, and then we went to the hospital and make sure everything was okay and everyone was fine. But yeah.
Oh my gosh.
World's best claims to be afraid of blood. Cleaned my whole house. I came home. You never know. She washed my pajama pants. I can still wear them.
Oh my gosh! Wow, we all need a neighbor like that.
Yeah, that's really sweet.
Yeah, so how many hours was it? Like when you broke your water to
an hour and 40 minutes from when my water broke to when she was born. It was an hour and 10 minutes from when my contractions started when she was born.
Oh my God, that is precipitous.
Yep. And typically second babies are faster, but
yeah, but that is less than 3 hours is fast.
Super fast. Yeah.
Oh my Lord. Especially since you didn't have like a fast-ish first labor, like call it the first sign of anything. 18 hours is, I mean, some people might be listening thinking, oh man, 18 hours labor. That's actually really awesome. I mean, the average length of labor for a first baby is like 24 hours. So, but wow, that's amazing. So your second baby's born, and so how was breastfeeding? Was there the same issues? What was going on?
No problems.
Wow.
It was like I've been vindicated from all the stuff I went through the first time. And so of course, like my husband and I are like paranoid. I'm like looking in her mouth. I'm like, it doesn't hurt to nurse. Her tongue looks fine. Of course, by this point, I feel like I could like get a PhD in like tongue ties. Stuff we go through with my son. And so, and then like they had a lactation consultant at the hospital. I'm like, I'm pretty sure the answer is no, but please send her in and like make her look. She's like, oh, she looks fine to me. I'm like, yes. And yeah, it was like easy. I never had any problems nursing her. I was like, oh, thank God.
Wow. That's really awesome, Kelly, that you, were determined to breastfeed again the second time, or at least give it a shot, because a lot of people, if they don't have a good experience the first time, they really are not interested in trying it a second time. And I don't blame them, because everybody has the right to determine how they feed their baby and what they use their body for. But unfortunately, a lot of times when somebody doesn't have a successful breastfeeding relationship with their first baby, it's not their fault. There's a lot of practices in the hospital that can really shoot people in the foot and set them up for failure. Hospitals that routinely separate moms and babies, after delivery, before the baby gets that first latch. Hospitals that don't encourage rooming in can decrease the amount of times that babies to breast throughout their hospital stay, which can affect milk supply. Many times hospitals have these slippery slopes of weight loss where even though the baby doesn't technically meet the criteria for losing too much weight, they're just close enough that the PD wants to give just a little bit of formula. And then, if you're giving formula instead of stimulating the breast and feeding at the breast, then the babies are full and then they don't want to eat. And it's like this vicious cycle. So, I'm just so again, you're the reason why we do what we do, because despite having such a really challenging, painful, exhausting time with your first for many, many months, not even weeks, you kept at it, you succeeded. And then the second time around, lo and behold, it was better. It was perfect. And that's the other thing too, is, anybody out there who's pregnant with their, second or third or fifth baby, and even if you formula fed all of them, every baby is different. Just because you had trouble with a baby, feeding the first time, for whatever reason, it might not repeat itself the second time. So, it's a lot easier to stop breastfeeding than it is to try to start it if you've decided not to start from the beginning. So you can always give it a shot. And if you just don't like it, it's not for you, then you certainly don't have to continue. But, know that there are many, many times where, people have successful subsequent breastfeeding relationships with other children, even if their first experience didn't go very well. So that's awesome. So what happened after she was born, as far as your toddler's curiosity about breastfeeding, with the new baby and things like that?
Well, so he was 22 months old. So, I mean, kind of still a baby. And so my parents eventually got here and they were staying with him for 2 days or whatever. We tried to get out of the hospital as fast as we could, still took forever. But so they brought him and he nursed when he was in the hospital. But he was like, I wasn't sure if he was going to continue or not. So I made my mom take a picture. I was like, this might be the last time that he nurses. And I actually don't even know where the picture is. It's probably like on her camera. So God knows where it is now. But yeah, so for the first couple days, probably, I'm assuming, while it was mostly still colostrum, he nursed a little bit, but like not that much. But when my milk came in, he was all over it. So he did not
So
wean.
when she was born, he hadn't nursed in how long? Like a month?
No, he nursed all the way until I went to labor.
Oh, that's right.
It was
That's
like
right.
a day and a half or something.
Okay. Yeah. Okay. Right.
So, but yeah, so he was all over the nursing when the milk came in, which was super handy because I still had a very forceful letdown, and so I would have him take the pressure off before I nursed the baby, so I didn't like feed her out of a fire hose like I did to him unknowingly for so long. So that was handy. He was like, "Oh, my turn. Okay," come running over.
Nature has a way of working things out, don't they?
Yeah, and then I quickly learned how to nurse them simultaneously because 22-month-olds are not well known for their patience. So I was like, screw this, like I'll figure it out. So I spent a lot of time on the couch with my shirt pulled up all the way and my nursing pillow around me with him on one side and her on the other side. And I was like, and by that point, like I had been nursing him long enough. I nursed him in public all the time. I was like, not a big deal, whatever. I was like, there could be nobody else in the house while I'm doing this because I'm basically sitting here with no shirt on. There's one kid with other people around, but I'm not doing it with 2 kids. So yeah. So when we were in public, I would only nurse one of them at a time, but at home, I would do it at the same time.
Yeah, that's another thing. People have a lot of misunderstandings about what nursing a toddler looks like. They think it's, that they're only nursing, that they're not eating food, which is just ridiculous, but because they are, and that you're a slave to them nursing whenever they want. They're just going to say, "Mommy, I want milk," in the middle of the grocery store, and you're just going to give into it. And first of all, like that, you don't have to do that with, they can say whatever they want to say. They can say, "I want Teddy Grahams right now." And you can be like, "No," it's like, hello people. But anyway, for a lot of times toddlers or 3-4-year-olds, when they're nursing, it maybe just be at bedtime. It might just be at nap time. It might just be milkies when we're home, not when we're out at the playground. Right. So, I mean, because they're an older child or a toddler that you can reason with, rationalize with, talk with, you can set boundaries that work for you, because again, full-term breastfeeding only works if it's mutually desirable for parent and child, right? So that sounds very similar to a lot of people's experiences. I know I nursed my first till he was 3, my second till 2.5. Both times we ended up weaning because I got pregnant, and it was painful for me, like I discussed. But yeah, if he would say, that he wanted to nurse, we were at the ecotarium, I'd just be like, well, we don't have nurse at the ecotarium. we have mom at home. That's what he called it.
Yeah, everybody has their nicknames for it. Well, I mean, I think too, though, Kelly, one thing that's helpful is that instead of having a 22, 23, 24-month-old running around wreaking havoc where you're like, oh, don't touch that. Oh, don't go over there. What are you doing? While you're nursing a baby, you can have him nursing you, except he's also old enough to know how to throw a little bit of a fist, I don't mean to say fist, but a fit of like,
he might throw a fist. I don't know.
But he like, really, no, I want to nurse. And you're saying no. So it's like this, right? Did you ever have those situations where you would tell him no?
It was always just, I mean, I don't know. I feel like I'm just like a lazy parent. I'm like, yeah, whatever. It's easier to just nurse them. So whatever. Like, let's just do it. So
Spoken like a mom of more than one right there. I'm
I'm like,
just
yeah,
whatever. Here's my boob. Like just
let's
Yep.
just do this, and then you'll fall asleep, and then you won't be a psycho anymore. Yeah.
I
Um,
do actually like what you said, Jeanette, about like they're not running around because you actually have them in one place. That's one thing that I missed when my kids did wean at 2.5 and 3 was that they were always running. And the only time they ever sat still was when we were snuggling together to nurse, even if it was only 10 seconds on each side. And so it was like, oh, that was one of those things I was like, oh, he's such a big boy now. You know, he doesn't want to just, sit down for a second. He's on the go all the time.
Yeah.
I have a question for you, Jeanette, as an IBCLC.
Mm.
I've heard a lot of people say, a lot of providers, pediatricians and OBs that, there's no nutritional value in milk after a year, right? And what do you say to that? Or that that a child needs cow's milk, that they don't, that breast milk after a year is void of nutrition and they need cow's milk. What's the science say about that?
The science says that's absolutely false, that human milk is evolving every hour, every day, every week, every month, every year to be different to meet the needs of that child. Now, it does change as you're pregnant, of course, and getting ready for a new baby, but absolutely it still has a lot of new and a lot of valuable components, and it's different when you're making milk for a 22-year-old than it is when you're making milk for a newborn.
Hopefully not a 22-year-old, actually.
Yeah,
Just
you
a
said
year?
right.
Well, that is also okay.
I would be comfortable with.
That is okay if the 22-year-old is nursing off of another adult who is willing
Like
to
another
do that.
consenting adult,
Yes.
not their mother.
Yes, that is okay. I don't think anywhere in the world would that be considered okay to be doing that with your mother. The oldest that I personally know was 8 years old, who was still nursing. Somebody that I met once, and I just like was like, I bow to you. That's amazing. But yes, it does change, and it is not lacking in value. The reason that it's recommended to switch to cow's milk is literally, if you look at the history, because the Dairy Council of the United States wanted to sell more cow's milk.
Mm-hmm.
And so they appealed to the USDA to say, hey, we've got a lot of milk. Can you make it a thing that Americans are supposed to eat, drink more milk? And so it was made that we don't need that. And of course, back in the old days, before the Dairy Council did that, Americans were growing, people living in the United States were using a lot of greens, and they were eating a lot of healthy calcium rich foods. And as we got more industrialized and started having less farming and more industrial and prepackaged foods, then they had to say, oh, well, what can we fortify with vitamin D, and what else can we get calcium from? And so they started to market it that way.
Yeah,
absolutely.
I have 2 dairy farmers in my family, believe it or not, and they talk about big dairy all the time. I mean, that's the thing. Like, people talk about big pharma. They talk about big what the big dairy is a huge lobby.
Yeah.
So if you're ever interested in learning, I mean, I love personally, I love cow's milk.
Me too.
I think
Me too.
It's just, but it's just not one of those things that children have to have, especially since breast milk, if they are drinking breast milk, that that's nutritious and has calcium and good fats for their brain and development, and also antibodies. Let's not forget that. I mean, there's a lot of immunology research that shows that the breastfeeding till the age of at least 2 corresponds to when like the immune development of a child, right? Like there's something around the age of 2 where the kids can start to, like, their immune system is more mature. Like it takes 2 years to mature an immune system at least, right? And so that breastfeeding relationship is giving those immunities to that 2-year-old, and lots of benefits. Honestly, my son, my first son, he had Coxsackie virus, which is hand, foot, and mouth disease, 3 times in his first year and probably 2 times his second year. I've never, it's one of those things they say, oh, once he gets it, he'll never get it again. No, there's like 16 strains of it. And so that causes sores like in their throat, and he would not eat anything. He would not drink water. He would scream. The only thing he would do was nurse at the breast, not even from a bottle. And so I know for a fact, I am a nurse, I know for a fact that if we did not have that, that he would have ended up in the hospital needing IV fluids because he
Yeah.
was so sick. Of course, my second never got sick. I don't know. It's just my first. But so there's many benefits. It's not devoid of nutrition. And the other thing too is this whole idea of 12 months being when you have to introduce cow's milk is also because, it's not safe to introduce just cow's milk to a baby less than 12 if you are formula feeding, right? Like formula has more nutrients in it than a glass of whole cow's milk. And so if parents are struggling to pay for formula and are trying to look for a substitute, like, watering down formula with giving
Which is dangerous for the
cow's
baby's
milk.
kidneys too.
Exactly. Very dangerous for the baby's kidneys. So this idea of, giving milk, cow's milk at 12 months of age is also related to this. If you are formula feeding your baby, it's now safe to give cow's milk instead of infant formula, because they can eat complementary foods and this, that, and the other. Not the same idea for a breastfed baby. You don't have to introduce cow's milk. It's just that their system is mature enough now that many babies wouldn't, be malnourished if they received cow's milk or have a bad reaction if they received cow's milk. Some still do, but that's the other thing, you got to think of as well.
Right.
So there's a lot of, so we know that it's biologically healthy to nurse a child past the age of 1. There are many health and immune and comfort and so many benefits, right? We've talked about many, but there's a stigma around it in this country. I mean, it's hard enough for people to breastfeed a baby. That there's this idea of like once they get teeth, like they can't nurse anymore. Like my first got his first tooth at 4 months old. And so that's ridiculous. That's not evidence-based.
Well, it's also a funny thing.
I did too. My oldest got his first 2 teeth at 4 months old.
Really? Yeah. So people are like, once they get teeth, you're going to wean, right? It's like, no.
No, I think my husband has a full mouth, and like
Right.
most people have relationships that, and nursing is not sexual, of course, when done by a baby or a toddler, right? But it's really silly that we forget that as adult humans, we might actually suck on someone's breast or teat, nipple, whatever it is, with a full mouth of teeth, and we're able to not bite. Right. And there is a transition for a lot of kids when they're nursing and becoming kids with teeth, where some kids bite more often than others, and we have to teach them to not do that. And some people have a harder time doing that than others. But yeah, it's not. So how was your stigma with your friends, or was there one? Like, Kelly, like what happened with your friends and your family? Did they
your
know
social
you were
circle,
nursing? I know you were nursing so long?
Yeah. Oh, yeah, they all did. I know it's normal to have people be weirded out, and I feel I'm not a good example of that because nobody gave me any crap about it. When I was first nursing my son when he was just a baby, my mother-in-law was a little bit uncomfortable, like in being in the room when I was nursing and whatever. But eventually, she just got over it because I was like, whatever, you can leave if you want, but I'm not going anywhere. So yeah, I mean, other than that, I think, yeah, but I had a neighbor around the corner who is actually, I think she's the one who told me about your group in the first place. Her son is about 2.5 years older than my son. And so she nursed him until he self-weaned a little bit before 2. And she has since nursed another child for a couple of years. And then I have 2 friends who live like on the other side of me who I did not meet through your group. And one of them nursed until her kid was over 2, and the other one until her kid was like 3.5. And then I have a lot of friends that I met at group and stuff. So I was just surrounded by other people who was like, not that, I mean, I nursed longer than my older son, longer than anybody else that I know, but it was not, but by the time he was really old, so he weaned at 4.5. So by that time it was like, just at home when he was taking a nap a couple days a week, whatever. So it's not like it was weird or whatever. So it was not a big deal for me.
There's definitely those stories of people that, say snarky things at, Christmas from the cousin and the aunt or the mother-in-law, right? But I feel like when I ask people this question, I get what you said, Kelly, more often than you would think, right? That I feel like it's in the shadows, but a lot of people nurse past a year, right? Like if you can get to a year, which is a huge milestone, I mean, give yourself a lot of credit in our society with, the terrible care we take care of new parents and sending people back to work so soon and, not giving them good breastfeeding support, in the hospital or, whatever, right? Not, it's a huge milestone to breastfeed for any amount of time. And it's a gift for any amount of time that you do it. But to get to a year is a huge milestone. There's not something magical that happens to a baby when they turn a year old, where all of a sudden they just like don't want to nurse anymore. And for most people. And so even if it wasn't your plan to nurse past a year, many people find that they are nursing past a year because their baby is still a baby. Like this idea that a 12-month-old is like a kindergartner. It's like, no, like if you actually spend time with babies, like you even said a couple minutes ago, something about like my 22-month-old. Well, I mean, he was still kind of like a baby because they are like less than 2. They're not really talking a ton, and they still like walk with bow legs, and like they're not preschoolers. They're still very baby like. And so many people who didn't even think that they were gonna nurse like that, be someone like that, ends up being that person because it's just a normal part of the breastfeeding relationship for so many people.
I get messages sometimes from people who are saying, hey, my baby's 7, 8, 9, 10 months old, and I know I'm going to stop at a year. So can you give me any tips for weaning? And I'm like, I have to kind of gently write back or talk to them about like, well, why are you stopping at a year? Is that what you planned and you want to do that? Or is there like a reason that you find that that's the perfect time for you? And a lot of times it's like, well, because I think I'm supposed to stop at a year. It's like, well, do you like it? If you're at that point, then it might be, if you're liking it, then you keep going.
You just froze a little bit. Do you want to say that last sentence?
No, I'll edit it.
Excellent. Jeanette, your kids are teenagers, and I know that you tandem nursed when your second was born with your first. Did you experience any backlash from any of your family or friends or anything like that?
So I nursed up until the day that my son was born, and my daughter was 2 years, 9 months, and 8 days. And I did not figure that out. The kids figured that out at some point. And I thought I was going to tandem nurse, but then my daughter didn't want to. So around 3 weeks, she was standing at my knee while I was nursing. And I said, do you want to do this? Because she literally said, like, when there's more milk, right? When the baby comes.
Oh, that's right. That's
milk,
right. Because your milk dried up. Yep. That's right.
And so she was standing at my knee, and I was like, do you want to do this? Because I hadn't offered it to her up to that point. And she's like, no, that's for the baby. So it was super easy to stop nursing her, because the last time she did it was the day her brother was born. She saw him come out. It was a planned home birth, and she was there. And I have no idea what went around that, but they're teenagers now, and they're very close to each other, and I don't know. And my second one, I nursed till he was like 2.5-ish. I don't remember exactly. But as far as people saying things, I was around a lot of people who had nursed for a long time, and because I was a birth doula and a childbirth educator and that kind of stuff. But I think like our personalities, including Kelly, like we're just sort of like, this is what we're doing, And
well,
there's a level of, I think, people who I know who nursed for a long time, not all of them, but many of them don't say they ever got flack from anybody because they're really like out and proud about it. Like, you're not going to talk to me about this because this is what I'm doing. And if you just own it and be like, this is what we're doing. But again, like some people are like, I'm still nursing my 5-year-old, but I only do it at night and on the weekends, which is totally lovely and fine. Like, you don't have to announce
whenever
to the
you're
world,
comfortable.
But some 5-year-olds, I know one 5-year-old in particular, four to five, I think she stopped around 5.5. She wanted to nurse a lot. And so she would come to the More Milk Mamas group for the older kids, and she'd be like, you guys, I'd really like to stop, but she likes to nurse like all day long whenever I'm with her. And we're watching, and we're like, okay, you've been here for an hour and a half, and she has nursed like 12 times.
Oh my gosh.
She's just constantly checking back in with mom. She's like, this is what she's like. I work full time, but this is what she's like when she's around me, and so she had to like really implement some really strategic plans to get her baby, her child, her 5-year-old, to stop nursing because she was done with it. Like mom was just like, I'm touched out, leave me alone, you know?
Oh yeah, I don't blame
And
her.
other people are like, oh my
my
gosh, my
son,
2-year-old.
I had a very specific plan because I was done, but he wasn't. Um,
Right. So how did that happen? Because you were still nursing your daughter. So he's seeing you nurse your daughter.
yeah, so that was hard. You know, you're talking about like before, like, oh, they're not running around and like causing a mess and whatever. It's true when they're like 4 too. Cause as soon as I was like, okay, so we like cut back. What did we do? First, we cut it back to just nap time, and he wasn't really napping anymore, so it was at his sister's nap time, so whatever, once a day. And then we ended up scaling back the number of days so that he was only doing it on the weekend at nap time. And we did that for like several weeks. And we had a family with my parents and siblings and stuff, a trip to Ireland in February. And so we were like, all right, you're turning 4.5 when we're in Ireland. You're gonna be a big kid then. You'll be closer to 5 than 4. Like then we're gonna be done. So the weekend before we went on our trip was his last time. And I thought it would be a bigger deal than it actually was. Because it took us like a couple months to like, peter down. And so we talked for several weeks beforehand. It's gonna be the last time. He's like, okay. So then I was nursing both of them at the same time for his last time, and I like took a couple pictures, and then like he was like, okay, I'm done. And I was like, okay. And he like left. I was like, I guess we're done then. And I think he asked like one time after that, and I said no, and that was the end of that.
Wow.
So,
That's some people have tough weaning stories like Jeanette was just talking about, but many people, it is the fear of the parent sometimes that it's going to be so bad. But if we can prepare our kids for lots of things, right? Like if you're still sharing a bed with them and you want to change that situation, or you're, new preschool or a new move or whatever. I mean, we have to prepare our kids emotionally and talk about it. And so I know that I did the same thing as you, Kelly. We talked about it for like 3 months beforehand. Like once I got pregnant with my second and my nipples were so sensitive, it was already painful. I'm like, okay, it's his birthday, he's 3, in 3 months, that's what we're doing. And so we talked about it every night. I made and I got these suggestions from the More Milk Mamas group that Jeanette leads for people who are nursing, babies that can crawl and beyond, right? And so, what somebody recommended, like, print out some, like, make a Google Photos book of like pictures of your son growing up, right? And then talk about like, oh, you used to crawl and now you walk, and you used to have to be carried and now you can run, and you used to drink mum, right? But now you drink cow's milk and eggnog. And so we would read that book, and then there was a couple other weaning type books that we had gotten suggestions again from other breastfeeding parents at group about like growing up and being a big boy, just like potty training, right? Like reading stories about it and preparing them. And I thought, like, he was such a boopy baby. Like I thought it was going to be tears and tantrums, and we prepared, like you said. And then I said, it's Christmas. Here's your eggnog. You're a big boy now. Yay. And he was just like, great. That was it. He like literally never asked again. And I think maybe when my second was born, maybe one time he said like, oh, can I nurse too? And I was like, no. And he was just like, okay.
But then I also know somebody who has 4 children, and I think it's her oldest one, who nursed, I think, the least of all of the 4 children because she didn't have as much support at that point. He likes to have mama's milk in a cup, and he's 7 now. And he has been having mama's milk in a cup for the last, I want to say, 3 or 4 years.
Good for him with the immunities. It's so funny.
Yeah.
My daughter was born last year, and so my second, Asa, my son, he was like, I want to nurse. I want mom. And I'm like, no, bud. No, it was like July. It's like 1,000 degrees. Last thing I wanted was him crawling all over me. And so I said, I'll put some mum in a cup, and you can drink it. He's like, this is terrible. I was like, hey, you used to drink it, dude. Don't knock it. Like, Marcy likes it. And it was just so funny. He's like, I don't want that mum anymore. No.
Yeah.
So sometimes you got to just let them have it, and then maybe they won't like it.
Yeah. So then you stopped nursing your son, and then how long has it been? And then you just stopped nursing your daughter, I saw last week, which is so timely for this conversation. But what made, like, how long did you end up nursing her, and what made you stop, and how did you do it?
Our last time nursing was the day before her 3rd birthday. So I nursed her for about 4 months after my son weaned. And so I'm expecting a baby in 6 months.
Congratulations.
Yay.
So I decided that I was not interested in tandem nursing her and the new baby. Because my other kids are 22 months apart. Like I said, my son was basically still a baby when she was born, but she's gonna be 3.5 when this baby's born. And I'm like, kind of ready to be done with that. We'll just do one baby this time around. So I knew my milk was likely to dry up since it dried up the last time. And she has never been as much of a boob addict as my son was. So I cut her back to once a day, and at nap time, she's not napping. Well, she's not napping at all now, but
Rest time. Mom needs a rest.
Yeah.
Put on a show
Mom needs
time.
rest.
basically it was once in the afternoon. If it happened to be when she was
Right.
napping, that's fine. Otherwise, if she didn't nap, it was just once in the afternoon. But even so, we started talking, same thing, long before her birthday. When you turn 3, then you'd be a big kid. You don't need to do mommy milk anymore. And so she's like, and then when the baby comes, there'll be more mommy milk. I can do it again. I'm like, no.
And so, but she didn't say, but dude, you nursed my brother till he was 4.
And so
She hasn't pulled that card on you yet.
So we talked about when you're 3, you're gonna be a big kid, blah blah blah. And so by the time we got to the end, my milk was dried up by now, and so it was a comfort thing. And so she would nurse for like a couple seconds, and I'd be like, "Is that side empty?" She's like, "Yes, on the other side." And then she'd be like, "This side's empty too." Sorry, nothing I can do about it. She'd be like, "Why is it empty?" And I'm like, "My body's not making any more milk. Like, there's nothing to do about it, kid." Like, sorry. So yeah, so then we're, on the day before her birthday, we're like, all right, it's gonna be the last day because tomorrow you'll be 3 and then you'll be a big kid. And so she has asked a couple times over the last week, mostly if she's very tired and got hurt at the same time. And then I just say no, and you cuddle her and whatever, and in a couple seconds she's fine. So
You're like, no, I took a picture of our last nursing and I posted it on Facebook, so it has to be official because it's on Facebook now that you're done.
also because mommy's very ready to be done.
Yes. There is a bittersweetness too, though, like when you're done. And one thing I don't know if you experienced this, Kelly, with any of your weaning episodes, but I had some pretty serious post-weaning, like exacerbation of postpartum depression symptoms that I didn't expect. So just be aware of that if anybody's listening and you're thinking about weaning. It kind of like my husband had to say like, hey, could this have something to do with the fact that you're not nursing anymore? And I was like, whoa, like probably, because that can happen too. What it was short. I had tools in my toolbox from when I actually had postpartum depression and anxiety, but yeah, it was just weird because it was just kind of came out of nowhere, and so just be aware of that as well. But it's moral of the story, right, is for as long as mutually desired by parent and child, right? So if it's not working for the babe anymore, then like Jeanette's daughter, she says, peace out, I'm done. That's for babies. If you got to read some books and talk about,
so the books, before we finish, which books? So what, I'm always forgetting all the names of them. There's like Nurses After the Sun Goes Down.
Yeah.
That's
Nurses with
for
Sunshines.
night weaning. It's called Nurses
Night
with
Weaning.
Sunshines. Oh my God, I have the entire book memorized.
And then
Wait, say it again. I had it wrong. So it's
Nurses when the sun shines.
Yeah.
Okay, so it's for night weaning.
Yes.
Okay.
And then Ready to Wean is another one.
It's not a very nice title.
Super creative.
And then I don't remember the other ones, but
plus the hard part is that weaning technically means the introduction of solid foods.
Right. Yeah. In other countries, weaning is not
in the United
ending
States,
breastfeeding.
Yeah. It's a little different.
Great. There's so many benefits in so many levels: nutrition, bonding, comfort, convenience.
Parenting, calm down, be nice.
Exactly.
Come over here and sit down.
The best boo-boo remedy, for nursing at whatever age and time frame works for you and your family. But you're not alone.
The longer that you breastfeed, the more similar your child's DNA becomes to your own.
Really?
Yeah.
Also, the longer you breastfeed, the less risk of breast cancer you have. That's not like if you nurse for
cancer as well.
Yeah. Not like if you have a if you can reach some X amount of months, then you'll never get breast cancer, but it just decreases your risk. So there's lots of benefits and lots of myths. So if you are nursing past a year, know that you are not alone. And you know what, if you're out and proud about it, you'd be surprised that you might not get any flack from. My husband said it. I said, I'm really lucky. I've never had anybody in my family give me a hard time about nursing the kids when they're in toddlers. He goes, yeah, I think they're afraid of you.
Yeah. When I was pregnant with my son, my mom was like, so it's kind of nice because I don't feel like I need to give you any advice because I know you're just going to ignore it anyway. I was like, oh, okay.
I'm so glad that we agree.
Once or twice over the course of her having grandchildren, she's like, okay, I know that you're just going to do whatever you want to do, but I feel it is incumbent upon me to say this. And so she'll say something, but it's only happened a handful of times. And then I smile and nod, and sometimes I take her advice and sometimes I don't. But yeah, so it's nice that they were like, yeah, we know you're just going to do whatever. Right? So,
and if you are getting a lot of, flack at whatever age for nursing, please consider going to one of Jeanette's groups, because that is the best place to be, or any breastfeeding support group, to have people be like, no girl, she's on whack. You're doing fine. This is what I would have said to her,
Yeah.
Well, just like when my son and I was, learning to nurse my first kid and whatever. And it was just so nice to have a social outlet that I didn't feel weird, like still fumbling and learning how to nurse and whatever. Because like by the time I was with my second, I was like, yeah, whatever. I've done this for a while now. It's not a big deal. And I didn't have any trouble nursing her. We didn't have any problems to work through or anything. So it wasn't, I still went to group when I could, and it was nice, but it wasn't.
I think you went to group when she was like 9 days old or something.
Probably escaping my son, but but yeah, I do remember I came when she was really little. But yes, but it was just so nice to have a place where I'm like, no one's gonna think I'm weird when I'm like, how do I get my kid to latch properly while I sit here with my boob hanging out or whatever? And I could have conversations with other adults. It's like, it's really nice.
And if you do nurse for a little tiny bit or a long time, there's badges that you can post on social media on babiesincommon.com. Yeah. So you can say to people like, I nursed for a whole month, or I nursed for 3 years, and just download that little badge and you can post it wherever you want. And then that normalizes breastfeeding for
totally.
people when
it's
they
all
see
about
that.
normalizing it. Absolutely.
Yeah. Well, awesome. Thank you, Kelly, for sharing all of that.
Thank you so much.
Taking time away from your busy children to share your story. So
my husband do bedtime by himself. So
sweet, awesome. All right, well, thank you. So we hope everybody will visit babiesincommon.com/show. And next week we have an episode about childproofing with our friend Kim Amato, who became even more of an advocate for childproofing and changing laws after she lost her 3-year-old daughter to a furniture tip over. So a much more serious episode than today's. But it's a great episode for people who are a parent, grandparent, or childcare provider, or those who have kids over to their house, because it can happen in just a second. So
she is a great advocate and an incredible speaker. I'm looking forward, even though it's a very serious topic, I'm looking forward to interviewing her next week. And as always, if you learned even one tiny morsel of helpful information, please don't be stingy. Text a friend who is pregnant, breastfeeding, or parenting and tell them about our podcast. And if you want to laugh your stretch pants off while learning about childbirth, babies, and breastfeeding, please consider taking a live and interactive Zoom class with us, or tell your friends about Babies in Common. Virtual feeding consultations and a weekly breastfeeding group called Breast Milk and Conversation, as we've talked about in this episode, is also available, again, through Zoom. You don't even have to put on pants, as we like to say. And if you follow us on social media, we're always posting great articles, videos, and other resources to help you rock your birth and thrive as a new parent, because we want to be a community for you. After all, we all have babies in common. Thanks, Kelly.
Awesome.
No problem.
Thank you.
Bye.